A document obtained by CTV News states emergency room waits in Alberta hospitals led to at least 6 deaths and more near misses for patients with serious conditions. The information was gathered by the Alberta Medical Association to highlight how the current political crunch is affecting Albertans waiting for care. Tyson Fedor reports.
The Premier and her health ministers are being warned that long hospital wait times are leaving patients to die in hallways and waiting rooms across the province.
On a regular basis, it's very difficult to provide safe and timely care to all the patients coming into our emergency departments and hospitals.
ER doctors sent the province a 6-page letter outlining recent deaths and dozens of near misses in overcrowded hospitals just since January 1st. The document obtained by CTV News calls it only the tip of the iceberg as to the immense suffering that is occurring. A woman in her 90s waited 8 hours for a bed suffering with septic shock. Another patient with pneumonia waited 18 hours before seeing a doctor. A man died after going to the ER with a fever, sore throat, and intermittent confusion. He waited 8 hours before leaving due to long wait times. Paramedics returned with him a couple hours later, suffering with multi-organ failure from strep bacteremia.
That document is some reinforcement of actual human suffering that the extreme pressure is causing.
Names and hospitals were not released due to confidentiality. The province says a busy flu season impacted care at hospitals, and Alberta's busiest emergency departments will soon see a doctor dedicated to triage.
We are now beginning to see signs that the situation is easing from the peak seen in late December, and emergency inpatient numbers have improved across several high-demand sites.
But not so, according to Dr. Paul Parks.
Extremely disheartening for myself, my colleagues in emergency medicine and internal medicine to hear the government's first response last week was that, our pleas for help and our cries to declare the crisis were misguided.
Alberta's opposition NDP wants to see long-term solutions rather than a band-aid approach.
This is not normal. This is not just a bad flu season. This is an utter and complete collapse of parts of the healthcare system, including ambulances and emergency rooms.
Tyson joins us tonight from South Health Campus. So Tyson, how is the province reacting to these latest cases?
Well, Tara, hospitals are operating around 102% capacity at the time being. The province will feel more comfortable if those hospital numbers drop to about 85 to 90% capacity. Now, according to this document, the province says it will not report or comment on it, as it calls it unverified, anonymized patient information. And it does take, though, seriously all patient outcomes. Now, Hospitals Minister Matt Jones did say that he is looking to meet with the Alberta Medical Association so that it can come up with plans for acute care pressures and solutions to address those. Tara?
Okay, Tyson, thank you.